Good morning to you, Dr. Fisher. Thanks for coming.
Good morning. Thanks for having me on.
So let's start with this. How are you? Because I was struck by this moment in the book when you talk about all of the preparations you had to do at the start of the pandemic, including making sure your affairs were in order, making sure your will was up to date. And at that point, we didn't know what was coming. So how are you?
I'm doing great. I mean, it was a terrifying moment because we didn't know how things were going. We didn't know if we would have vaccines as quickly as we did. You know, me and my colleagues, for 20 years, I've been taking care of sick people. And in that time frame, we always are making life and death decisions. Except at the end of every shift, we know we're going home. For the first time, COVID brought us into the equation and we could get sick. And over the course of the past couple of years, I've seen a number of my colleagues and friends become ill. Some of them haven't come back. But in the end, what we saw was something that is a part of all society, that a society stratified by race and caste, and one that makes winners and losers, made losers out of a lot of my patients.
So let's talk more about that, because how did COVID really expose the racial inequities in healthcare that you say is a problem as big as America itself?
Yeah. You know, there's an old saying that when America catches a cold, black folks catch pneumonia. We saw that during COVID, where essential workers tended to be black and brown, and we're out delivering our goods, stocking our shelves, and we're exposed to the virus, bringing that home to their multi-generational families, sickening their elders. Many folks who had better jobs were able to work behind a screen and were staying safe without getting infected. For them, it was more kind of a remote experience rather than one that was happening in their lives and in their families. And so it's not surprising, in the first year, the majority of the people who were getting sick and dying were black and brown folks, whereas those who were safe and protected tended to be wealthier and whiter and living in the northern areas of the city and in the suburbs.
The impact of segregation as well.
Absolutely. Segregation stratifies our society and delivers its goods and services predominantly to white folks, holding aside some of the challenges, the food deserts, the risky communities, the lack of health insurance to the south side. You wouldn't be surprised that those then lead to a 30-year life expectancy difference between Inglewood, a community near the hospital where I work, and Lakeview, a community up on the north side.
And it's important to note that you're not only dealing with the effects of the pandemic, you're dealing with the trauma of gun violence. And also, just as you describe in the book, this frantic pace at which you are seeing patients who have been waiting for hours and having to evaluate them within a matter of minutes.
I mean, put yourself in my shoes. If you come into the emergency department and there are 40 people waiting, some of whom have been there for 5 hours, and you only have 2 beds available, imagine picking which of the most seriously ill should go first. That sort of moral dilemma is one that we face regularly, and one that forces us to both remember that people are deeply human, all of us deserve care, and that we need to do better. We need a radical transformation of society to ensure that nobody is left behind.
Okay, so what changes need to happen in the healthcare system to make things better? Structural changes, because, as you said, this is a system that it has historically been resistant to change. So what needs to happen?
The sort of radical transformation that ultimately we need requires that we no longer elevate profit over people, and that we center humanity in every decision. These are the sorts of transformations that I don't expect to see in our lifetime. I don't expect us to cast aside racial stratification of our society in any short order. In the meantime, we can elevate moral leaders who are willing to make those hard decisions, and we can focus on systems rather than creating heroes and villains, and recognize that these are systems that are working exactly as defined, in order to ensure that the best go to those who have the most, and the least goes to those who need it the most. And we need to change that equation.
Dr. Fisher, thank you so much for coming in. Deeply appreciated the book. Thanks so much for your time. And you can find The Emergency wherever you buy your books. Hi, Tim.